Hello, my name is Olivia Pompa. First, I'm going to begin this video. This video is about x-rays of the wrist and the hand. First, I would begin with my patient by introducing myself. Hi, I'm student clinician Olivia. Today, we're going to be taking some views of your hand and your wrist. If you have any questions, please feel free to ask. Everything we discuss will be held in strict confidence. And may I begin? So I would do that. I would have my patients properly gowned, and let's begin. So I'm going to tilt my camera here so you can see my views here. Okay, I have my left marker. Okay, so here we are using my left hand. I have taken my rings off on this hand. So for all of these views, it's important to note that the SID is all 40. Okay. And the cassette size for the hand is 10 by 12. Today we're going to be doing 3 views for the hand, 4 views for the wrist, and 3 special views. Okay, so first we're going to start with P to A, hand. Okay, so first for P to A, hand, we're going to have the patient spread out his fingers slightly apart. Okay, the central ray, oh, and this is my marker, just saying that again. The central ray will be pointed into the third metacarpal phalangeal joint. And this view, it captures the distal ends of the radius and ulna to the ends of the phalangeals, or the fingers. Okay, next we're going to be doing the medial oblique. Okay, I have my wedge, which is actually my Bible, but my wedge. Okay, so this will be my wedge today. So for the medial oblique, we're going to have the patient lay their hands like so. Okay, it's important to note that this wedge is at a 45-degree angle. So that their hand is on this 45-degree angle wedge. Okay, and the central ray will be perpendicular to the third metaphalangeal joint. Okay, right here. Okay, and we are capturing in this view the ends of the phalanges, why do I keep saying that word weird? Phalanges to the distal ends of the radius and ulna, okay? It's important, though, to note in this view that the phalanges, they're parallel to the film plane line to keep the interphalangeal joints open. Okay, great. So we're done with our wedge. Next, we're going to be doing the lateral hand. Okay, so for the lateral hand, okay, we're going to ask the patient to make an OK sign. The fingers are not touching. Okay, they're just relaxed like so. These 2 fingers making an OK sign. In this view, the hand and the wrist are seen in this view. The central ray is perpendicular to the metacarpal phalangeal joint. Okay, I'm moving my wedge here. And it's important to also note that the forearm and the hand is resting on this ulnar surface like this. You can't really see it in this, but like resting on the ulnar surface. Okay, and it's also important to note that you ask the patients to extend the fingers away from each other like that. So that is the lateral hand. We do view the hand and the wrist in this projection. Trying to think if I missed anything. Yeah, I think that's good for now. Okay, so the next view that we're going to be talking about today is P to A wrist. Okay, so that was the hand. We're going to do the wrist now. So for the P to A wrist, we're going to ask our patients to make a light fist like so. Okay, our central ray is going to be coming down into the mid-carpal area. Okay, in this view, we see the distal ends of the radius and ulna to the proximal ends of the metacarpals and the carpals here. So here, and then the distal ends of the radius and ulna. Okay. Next, we're going to be doing the medial oblique of the wrist. So same thing as before of the hand. We're going to pull out our 45-degree wedge, which is my Bible. So here we are. Okay, have our marker, very important. Okay, so we have our patient's hand rested on this 45-degree wedge. Okay, This is an oblique projection of the carpals. So we're seeing an oblique projection of our carpal bones here. Resting on the 45-degree wedge, the central ray is entering perpendicular at the distal radius. So here, okay? So that's the medial oblique wrist. We're done with that. Okay, next, we are going to be talking about our medial, I'm sorry, not medial, why am I saying that? Lateral wrist, okay? So here we are, lateral wrist, okay? What's important to note about the lateral wrist is that the forearm and the forearm and the hand has to be in line with the carpals. So if I was like this, that would be wrong, right? So we're in line with the carpals, right? Our elbow is flexed at 90 degrees. It's probably easier if I'm turned, but it's a little hard in my positioning here. So our hand is in line with our forearm and our elbow is flexed at 90 degrees. It's important that our ulnar surface is flat on the table. Our central ray, right, is perpendicular to the wrist. So in here, right, in this projection, this is a lateral projection of the carpals, and we see the proximal ends of the metacarpals and the distal ends of the radius and ulna. Okay, so that is the lateral wrist. Next, we're going to talk about the lateral oblique. Okay, for the lateral oblique, I'm forgetting at the moment what we do here. For the lateral oblique, oh yes. So the lateral oblique, we're going to ask our patients, like so, to pull their fingers back as far as they can. Okay. Nope, that's not the lateral oblique. Oh, forgetting what the lateral oblique is. Let me peek here. Lateral oblique. Why is the lateral oblique? Why am I forgetting what the lateral oblique is? The lateral oblique. I should know this. Oh, yes. Now I remember what the lateral oblique is. Okay, so we start here and we tilt 45 degrees, okay, up. And the central ray for the lateral oblique is at the distal radius and ulna. So here, okay? Sorry about that. Okay, next we're going to be talking about our special views of the wrist and the hand. The Gaynor-Hart method, it shows us the carpal tunnel area. This is what I was trying to show you before. We're pulling, the patient is going to pull their fingers back as far as they can, okay? It's kind of easier if you do it like this. And the central ray is 25 to 30 degrees cephalad to enter approximately an inch distal to the base of the fourth metacarpal. Okay, so that is the Gaynor-Hart method where they're pulling their fingers back. We see the carpal tunnel area in this view. Okay, next is the ulnar flexion. So our ulnar deviation, as we call it also. This is a view for the scaphoid. This view is really great for the scaphoid because it opens up this, this area here, and it prevents any imposition, right? It allows for no imposition of the scaphoid. So we're going to ask our patients to deviate their hand here, ulnar deviation. The central ray is perpendicular to the scaphoid, like so. Okay. It's also important to note that this view can also be done with a 20-degree tube tilt. Okay? And the last one that we are going to do here is the pisiform view, also known as the stretcher's view. Okay, so for this view, we only need a 20 degree wedge here. Let's just say this is let's just pretend this is 20 degrees here. Okay. Flexion of the wrist, right? So obviously this would be, if this was 20 degrees like this, okay, we have flexion of the wrist here. Obviously, your patient wouldn't be like this. They would be like this, but for the sake of this video, here we are. Okay, and the central ray is perpendicular at the center of the wrist. Okay, thank you. My name's, oh, wait, one thing that I forgot, though, was the marker for this one. So we want to always make sure that our marker's in the view, and it would be here. Okay.